Hello everyone, and welcome to my channel, Coco and DTV, where we discuss mind and body matters because both your mind and your body matters. And today's topic of discussion is PTSD. PTSD is post-traumatic stress disorder. And before we talk about the disorder, I want to give you a little information about order. And the natural order of our body is when there is a threat on the outside, we have complex brain structures that determine the threat level and help our body to respond in either fighting or flighting or going away from the threat. And our body responds by, if there's a threat, we're going to increase our heart rate to pump blood to our extremities so we can run. We're going to divert blood flow away from our tummy and gut area because we're not really wanting to rest and digest. We're needing that blood to go to our legs and to our arms. Our pupils are going to cue in just in case we need to focus on something. So these are body responses to threat. And then after the threat is removed, those things should all come down. Your heart rate should come down. You should be able to rest and digest. You should be able to relax. And what PTSD is, number one, there's a trauma. And what the trauma could be is something I usually tell my patients, is it something that's like, it could be on the news or something that's abnormally wrong. Like it's not like a breakup, although sometimes those could be really traumatic. It might be like a sudden death of someone close to you, or trauma, witnessing gun violence or something like that. So you have this trauma, and then you have these specific reactions over a certain period of time. One of them is like your mood and thinking is negatively affected as if you're still in danger. That's one. Number two, your body is still reacting as if you are in danger. Three, you're staying away from the things that remind you of that danger, even though you're not in danger. And then four, you keep reliving the experience. So when somebody is having those symptoms over a period of time, that will constitute as, and not only that, but it's impairing their lives in some way. If somebody is so afraid of something that they are investing thousands and thousands of dollars into a security system that they may not need, or they can't go in a certain area because it reminds them too much of the trauma. They can't relax. They can't sleep, having nightmares. These are symptoms of PTSD. And I'm going to ask some questions, the top 5 things that I hear. One of them is, does everyone who has been exposed to trauma get PTSD? And the answer is no. Some people have that remember the natural order, the response after the trauma is gone, after the bad event or threat is gone, their bodily processes go down. Okay, and number 2, if I feel scared following a trauma, is that PTSD? And no, it's natural to feel like afraid after a traumatic event, but again, your bodily processes and your thinking regulates. 3, is it okay to live like this? Like, what's wrong with being kind of like hypervigilant, watchful, that kind of stuff? No, it's not okay. You should seek help, especially if it's impairing your life, because a lot of times when you are in that hyper aroused state, it's not fun for the people around you. If you're always suspicious or always on the lookout or irritable because you can't sleep, it's not really fun for the people around you. There's brain changes, some things that maybe you're not familiar with, like people with PTSD tend to have smaller hippocampuses, and that deals with memory, stuff like that. It also affects your immune system and your blood sugar. So it affects metabolic processes. So it's not okay to just live in that constant fight or flight state. Number 4. Can you recover from PTSD? Or once you've experienced that trauma, is it like you're gonna have PTSD forever? Yes, you can recover from PTSD. That is why I have a job. So what are some of the treatments? There are antidepressants. There are blood pressure medications that take some of those bodily processes down. There's psychological interventions, exposure therapy. There are lots of interventions for PTSD if you seek help from a medical professional. Don't be discouraged if you have to try multiple interventions. Sometimes you don't get it on the first shot. Sometimes the first medication doesn't work. Keep trying. It's okay. Also, this is really important. Severe PTSD, chronic PTSD can be misdiagnosed. I have a lot of patients that come in and they say, oh, I have a diagnosis of bipolar. And I go through the checklist and I'm really talking and finding more about their history. And they really don't have bipolar disorder. It's really just chronic severe PTSD. So that's why it's important to go to a medical professional or a mental health specialist for the diagnosis of this condition. And here's a big caution. Don't try to drown out your sorrows with alcohol or cannabis. Can be lightening it up, blowing it down, because what happens is it usually compounds things and makes it worse. And a lot of people think that all military members have PTSD, or everybody who's had a battle experience has PTSD. Also, that's not true. People respond to traumas differently. But if anybody you know or you are having symptoms and you haven't seen a mental health professional, please make an appointment. There are lots of interventions out there for you, and then you can kind of bring some balance to your universe and not live in the fight or flight. I hope this video has been helpful for you. If you have any questions, you can comment below. Please subscribe, and God bless. Take care.